Hi, I'm Heather Thorn. I am an exercise physiologist at the Wellness Center in Tupelo. I do fitness testing, personal training, teach aerobics classes, and do educational talks. Yes, there are. According to the American College of Obstetricians and Gynecologists, as well as the American College of Sports Medicine, there are many benefits to exercising during pregnancy. It may lower your risk of gestational diabetes. It will help control weight. It will possibly lower your risk for other health problems like preeclampsia, and then also reduce your risk of having cesarean or preterm birth. It also can improve your mood and reduce anxiety associated with pregnancy. 150 minutes of aerobic activity, moderate, each week is what's recommended for healthy women that are pregnant. 2 to 3 times a week of resistance training or strength training, and 2 to 3 times a week of flexibility training to keep your body in good shape for your pregnancy and beyond. Okay. Well, for aerobics, you could do walking, light jogging, swimming, water aerobics, cycling on a stationary bike are all good forms of aerobic activity. As far as strength training, you can use machine weights, dumbbells, or your own body weight to keep your muscles strong throughout your pregnancy to help you through the pregnancy as well as in labor and afterwards. And then the flexibility training you could also go to a class of yoga, Pilates to help with the core, and stretching on your own.
Aerobic exercise is very important for a pregnant woman and her unborn baby. Getting 30 minutes most days of the week would help your heart, your lungs, and your mood. One of the things you could do is indoor cycling on a stationary bike. If you don't have access, you can always walk with a friend outside or meet up inside somewhere to walk. One of the exercises you can do to strengthen your lower body are squats. Now you could do these in a gym setting or you can do them at home in front of your couch. So you're going to stand with your feet shoulder width apart. You can take your arms out for balance. You're going to lower your body down toward the surface but not touch the surface, and then slowly come back up, keeping the abs drawn in. You're going to exhale on the way up and inhale on your way down to strengthen the legs and your glutes, which will keep your legs strong throughout your pregnancy. Another exercise to help keep your core strong during your pregnancy is something I like to call the bird dog. It can be done anywhere, on the surface, on the floor in a tabletop position. You're going to take your right arm out and your left leg back, squeezing the glute as you lift the leg. Draw your abs in, take your elbow to meet your knee or as close as you can, and extend it back out. And as you do this, you're going to do 10 to 12 on one side, and then take it down and switch and do the other arm and the opposite leg, and repeat to keep that core and that low back strong throughout your pregnancy. Another good exercise to do for strength is a chest press or a push-up. If you don't have access to a gym to do an upright chest press, which is good for the chest and shoulder muscles, you can always do a modified push-up on the floor or even one on the countertop or table. You're going to make sure you draw your abs in when you do this, so you will also work your core. So you're going to start with your hands on a countertop or table, abs drawn in, pelvis tilted under, and you're going to slowly lower your chest down toward the tabletop or counter and slowly come back up, all while keeping your hips in line and your abs really tight. In the gym, you have lots of equipment to access to work abs, but at home you might have to get real creative with it. So one of the things you can do, since you're not supposed to lie directly on your back while doing ab work after the first trimester, is to lay on the forearms, or you can even use a resistance ball to help support your back and keep your chest lifted. And you're going to do something called the heel drop that will work your abdominals. You're going to lift one heel and then the other and slowly bring that heel down to the floor using the ab muscles as you go along. You want to do about 10 to 12 of these and rest and repeat. Another strengthening move that you're going to need for lifting that baby is some arm work. And one of the things you can do to help get those arms stronger for lifting is bicep curls. So you're going to start with a pair of dumbbells, either hold them hammer style or forward, and you're going to lift up to the shoulder and slowly lower it down. So you don't want to get momentum swinging and hurt your back as well. You just slow and control, move it up and down for 10 to 12 repetitions. If you're very active, you can do 2 to 3 sets. If you're a beginner, you need to keep the weight very light and just do 1 set. A good flexibility exercise for your hamstrings, which can get tight along with your back, is to do a hamstring stretch. Now you can do them at the gym or you can do them at home. At home you can do them on the floor or on a chair. You can take your right leg up, holding on to a surface for balance if you need, and then you're going to lift the chest and fold forward just at the hips until you feel a mild pull in the back of your leg. Hold this to 10 to 30 seconds and repeat on the other leg. Using a pool to do your cardiovascular exercises is a great idea for pregnant women. 2 of the things you can do in the pool are swimming or water aerobics. So if you're swimming, it takes the pressure off your back and your other joints, so it feels better and it may help relieve your back pain. And if you're doing water aerobics, it can keep that heart rate up and you can be in a group setting while you're doing that. Just be careful. You sweat in the water as well, so you do want to keep hydrated while you're doing this.
Anytime you start exercising, you want to watch out to not exercise in a hot or humid environment, which may mean during this time of year you may want to exercise indoors, which would keep you cooler. Also, in getting too hot, you want to make sure that you're hydrating, drinking lots of water before, during, and after, so you do not get dehydrated. Yes, high intensity exercise, especially if you haven't been exercising, should be avoided unless you've consulted your physician. Also, you want to avoid doing anything on your back, like crunches after your first trimester, so you don't put too much pressure on your major arteries that go to your heart. That would hurt you and the baby as well. Another thing would be to avoid racket sports, as well as contact sports or anything that might make you fall and cause trauma. The first step was to consult with your physician and then get clearance from them. Then come to us at the Wellness Center and we can design a program for you based on your needs and what you're wanting to achieve to help you through pregnancy and beyond.